Welcome to Med About You, your health solution. What happens when you take Viagra daily for 30 days? Taking Viagra, sildenafil, daily for 30 days can have a mix of potential benefits and risks, depending on your health condition, dosage. Here's what generally happens. Possible effects and benefits. 1. Improved erectile function. Consistent use may help men with erectile dysfunction, ED, achieve firmer, longer-lasting erections. It increases blood flow to the penis when sexually aroused. 2. Boost in sexual confidence. Regular success in sexual performance often reduces performance anxiety. 3. Better blood vessel health potential. Some studies suggest sildenafil can improve blood vessel flexibility and lower pulmonary blood pressure, why it's also used in pulmonary hypertension. For improved urinary and prostate symptoms, some men. Daily low-dose Viagra has been shown in some research to help urinary symptoms in men with benign prostatic hyperplasia, BPH. Risks and side effects of daily use. 1. Tolerance and dependency. Psychological dependence may develop, feeling you need Viagra to perform. True physical tolerance is rare, but anxiety without it can occur. 2. Common side effects, more likely with daily use. Headaches, flushing, nasal congestion, indigestion, back pain. Some men experience dizziness or blurred vision. 3. Blood pressure changes. Sildenafil lowers blood pressure slightly in men already taking BP medications or nitrates. This can be dangerous. 4. Possible heart strain. If you have underlying heart disease, daily use without medical supervision could increase cardiovascular risks. 5. Vision and hearing concerns, rare, long-term use. Rare cases of sudden vision or hearing loss have been reported. Important considerations. Viagra is not designed as a daily drug, unlike Cialis, which has a daily version at low dose. Doctors sometimes prescribe low-dose sildenafil daily for pulmonary hypertension or prostate-related issues, but this is medically supervised. Self-medicating daily for 30 days without medical advice can be risky. What is Viagra? Viagra is the brand name for sildenafil citrate, a medication primarily used to treat erectile dysfunction, ED, in men. It was originally developed by Pfizer and was approved by the U.S. Food and Drug Administration, FDA, in 1998. Besides treating erectile dysfunction ED. How Viagra works. Viagra works by enhancing the natural process of achieving an erection, which involves increased blood flow to the penis. It is not an aphrodisiac and does not cause sexual arousal. The drug is effective only when a man is sexually stimulated. Viagra belongs to a class of drugs called phosphodiesterase type 5, PDE5, inhibitors, which increase the levels of cyclic guanosine monophosphate, CGMP, in the body. This promotes relaxation of smooth muscle cells and dilation of blood vessels in the penis, leading to improved blood flow and the ability to achieve and maintain an erection. Uses of Viagra. Erectile dysfunction, ED, to help men achieve and sustain an erection during sexual activity. Pulmonary arterial hypertension, PAH, sold under the name Revatio to reduce blood pressure in the lungs and improve exercise capacity. Important notes. Viagra typically starts working 30 to 60 minutes after ingestion and its effects last for about 4 to 6 hours. It requires a prescription and should only be used under the supervision of a healthcare provider. It is not recommended for use in women or children. Viagra has become one of the most widely recognized medications for ED and has transformed the treatment landscape for this condition. Viagra, sildenafil, mechanism of action. Viagra is a phosphodiesterase type 5, PDE5, inhibitor primarily used to treat erectile dysfunction, ED, and pulmonary arterial hypertension, PAH. Its mechanism of action is as follows. 1. Nitric oxide, NO, release. During sexual stimulation, nitric oxide, NO, is released in the penile tissues. 2. Activation of guanylate cyclase, nitric oxide activates the enzyme guanylate cyclase, leading to an increase in cyclic guanosine monophosphate, CGMP. 3. Smooth muscle relaxation. Elevated CGMP causes smooth muscle relaxation in the corpus cavernosum, allowing blood vessels to dilate. 4. Enhanced blood flow. Increased blood flow to the penis facilitates an erection. Viagra side effects. Like any medication, sildenafil may cause side effects, which can range from mild to severe. 1. Headache, due to vasodilation and increased blood flow. 2. Flushing, redness or warmth, particularly on the face and chest. 3. Dizziness, caused by changes in blood pressure. 4. Nasal congestion, mild swelling of nasal passages. 5. Indigestion, dyspepsia, stomach discomfort or acid reflux. 6. Visual disturbances. A. Changes in color perception, for example seeing a blue tint. B. Blurred vision. C. Back or muscle pain, often mild and temporary. Note, Viagra side effects vary based on individual tolerance, dosage, and pre-existing conditions. It's crucial to consult a healthcare provider for personalized advice and dosage recommendations. What happens when women take Viagra? Viagra, sildenafil, is officially approved for men with erectile dysfunction, but it has been studied in women too. Here's what happens when women take Viagra. How Viagra works. Viagra increases blood flow by relaxing blood vessels. In men, this means more blood flows to the penis. In women, the idea was that it might increase blood flow to the clitoris, vagina, and pelvic organs, potentially boosting sexual arousal and sensitivity. Possible effects in women. 1. Increased blood flow to genitals. Some women may experience increased genital sensitivity, lubrication, and stronger orgasms. 2. Helps certain medical conditions. Female sexual arousal disorder, FSAD. Some women reported improvement, but results are mixed. Antidepressant-related sexual dysfunction. In women taking SSRIs, antidepressants, Viagra sometimes improved arousal and orgasm issues. Fertility treatment. Sildenafil is sometimes used, as vaginal suppositories, not pills, to improve uterine lining thickness and blood flow to help embryo implantation. Side effects in women. Similar to men, women may experience headaches, flushing, nasal congestion, indigestion, dizziness or vision changes. These happen because Viagra affects blood vessels throughout the body, not just the genitals. Thanks for watching. For more informative videos, please visit our channel. Please like, share, and subscribe.